Hello and welcome to the Sex and Wellness Podcast. Today we have Dr. Michelle Weeks, who's a doctor of physical therapy, an orthopedic physical therapist, and a pelvic floor physical therapist. She owns 3 clinics in Cambridge, Massachusetts, Tallahassee, Florida, and Panama City, Florida. She's also a board certified women's health clinical specialist, and we're excited to have her here on the show to talk about some constipation.
Thank you.
How are you doing today, Michelle?
Hey, I'm doing good, Mary. Thank you for having me.
Sure. I'm excited to chat with you about poop, constipation, all the fun stuff.
Everyone always gets squeamish to talk about poop. But we need
to be pooping. We need to have the conversations. If you're
not pooping, you don't feel good.
Exactly. So today, the show that we're talking about is why am I constipated? So we have a question from Nancy, who is 33 years old. She is 6 months postpartum.
Okay.
She wants to know why she's constipated and what we can do to help, since no one seems to know why. She indicates that this has been going on years prior to pregnancy as well. So
that's really, normally, I feel like a lot of people are constipated and don't even realize it. So kind of number one.
Well, I think that's a great thing to bring up, because when I ask people like how often they're pooping, they might say once a day. But when I ask them what it looks like, it's like, little round balls. That's constipation.
Or how long it takes them to poop. So, they can be going once a day, but sitting on the toilet for 20 minutes. You just strain as hard as humanly possible in order to poop. And so that's not great either for our system, and a sign of constipation. So absolutely, it's definitely not just frequency. Rarely is it frequency in my clinic. I don't know if you're similar findings.
For me, it varies. What I've been running, you kind of go through waves with clients. Some people come in all with like similar stuff, for a few months, and then you see a wave of different things. But I think the biggest thing that I see is the saying that they're pooping once a day. But when I start asking questions, it's like, what does that poop look like? And I just love people's reactions to this when I do it. Somebody called me a poop coach the other day. I was like, I like it. I dig it.
Embrace it.
I am embracing my inner child with talking about poop as my profession. I'm digging it. So what do you think, what are some common reasons that you see constipation occur?
Yeah. So especially, for Nancy too, the big things in any postpartum period, or really not postpartum as well, are going to be diet. So what we're eating really makes a difference. Some people more than others. Our pelvic floor muscle function. And so that plays a large role in our ability to poop and poop successfully. We want to look too up into the abdomen and to our diaphragm. Make sure that there's nothing going on with our breathing muscle or abdominal muscles. That definitely can cause some issues with pooping. And in the postpartum period, if we're breastfeeding, that can definitely also lead to constipation, really for 2 reasons. So one, from a hydration standpoint. So we all know that when we're breastfeeding, or we should know that we need to really be drinking more fluids in order to produce breast milk. And so if we don't increase our hydration, that definitely can lead to constipation. But also hormones can play a role in constipation as well. And so breastfeeding can also impact from a hormonal standpoint in that postpartum period. So generally, that can definitely be some of the top reasons that I'm seeing people for constipation as well.
Yeah, I want to dive into each of those in a minute, so people can kind of understand what exactly those things mean from a non kind of pelvic floor perspective. But another thing that you and I were just chatting about before we jumped on here is really the start of digestion is chewing, and A lot of times if we're not sitting down and chewing into applesauce consistency, which let's be honest, like not every day or every time we eat, we can do that, but just understanding that if you are experiencing about a bout of constipation, thinking about the digestion aspect, right? We chew our food, and then our body digests. But if we're eating, like we're grabbing like a biscuit, we're eating it whole, while we're running around grabbing the kids or getting ready for work or running late, our nervous system goes into that fight or flight response. And, the blood diverts away from the gut. And that's when we get bloating and, constipation and diarrhea, because our body thinks we're being chased by a bear because we're in fight or flight mode. It doesn't know, hey, it doesn't know that we're just running around because we're running late. And so that's one of the bigger reasons too, that I find that, and hydration to kind of add onto that.
Yes.
But let's go back to what you were just saying from the beginning. So the first reason you saw
is diet. And so this kind of goes hand in hand too with what you were just saying. It's important to chew food and sit down and rest and eat, but it also is important about what we're putting into our body.
Mm-hmm.
So oftentimes things that we grab and go really fast are not the best nutritionally for our system either. Oftentimes, if we're not eating enough fiber, that's slowing down the way things are moving through our digestive tract. And so making sure that we're eating good sources of fiber as well. So not just taking a supplement. So, saying, oh, well, I take citrusol or Metamucil, our body's not absorbing that the same way as if you were eating good sources from fruits and vegetables as well. That really help move things through your gut to prevent that constipation from happening. So that's definitely a lot of what I see too, and just helping people to make smarter choices and plan ahead in a realistic way as well. So what are things that they can maybe prepare to eat and not spend hours in the kitchen if they have, kids running around that they need to kind of chase down. So being able to help navigate what smart decisions and foods they should be eating. So.
Yeah. And I think, there's this misconception that eating, fruits and veggies is not delicious, right? Which, I mean, if you never really do it, if you eat it raw, it may not be as amazing, but some things that I'll do sometimes is just like try to get a veggie in for each meal in some form or fashion, because when I really sat down with a dietitian years ago, we were looking at my diet. I was experiencing a bout of constipation myself, and I was like, what is happening? And I was just eating a ton of nuts, a ton of peanut butter, a ton of nuts, a ton of oats, like a lot of stuff that, of course, when I looked at it, I was like, oh, peanut butter is going to slow, for me, it can slow some of the digestion stuff down. But I mean, even you can make it like, I make some chicken Alfredo. I toss some spinach in there and call it a day. Add in some, some good sauce. It doesn't have to be this, I have to just eat carrots with nothing on it,
Exactly. Doesn't have to be that big of a shift. Start small and where you can to incorporate, just some healthier items each meal.
Yeah. Yeah. No, I mean, it makes sense. And so what was the second reason you had said? Was it the water or was it pelvic floor dysfunction? Which one?
Pelvic floor dysfunction, but water probably is a better one to follow up with diet. Hydration is so important. Most people definitely are not.
Yeah, they're not drinking enough water. But can you break down the physiology behind the water? Because I think a lot of times people are told a lot of this stuff, at least, even just what I hear is like, oh, if you're constipated, have fiber, or if not, drink water. It's like, okay, that's great. But I think a lot of people really resonate it when we say like the reasons why. Because I know personally for me, I'm more likely to do something if I understand the mechanism behind it. Because if I just hear that, I don't understand it, so I don't do it. And I find that kind of explaining that sometimes to my clients, it can resonate a little bit more. So what is the reasoning behind the water?
Yeah, absolutely. That's so great. So for normal digestion, the pathway that our food goes is, so first our mouth, we chew, swallow, goes into our stomach. When our stomach's done digesting, it empties into the beginning of our small intestine. And so it travels through our small intestines, which most people know are, I don't even know how long, 45 feet long, something very long. And they're all wound up inside of our abdomen. And then our small intestine dumps into our large intestine down to the lower right side of our abdomen. And so really once that food and substance gets into our large intestine, the process there is for the large intestine to start to pull some of that water out to form stool. And so if once that gets to our large intestine, and if it's sitting there for too long, then imagine that all of that water is coming out. And that's how we can get some of those really hard stools, because they're so dehydrated. And now it's definitely become more of a solid substance. And that is harder then to move through our large intestine to be able to poop that out. So if we're more mindful about improving our hydration, that is actually going to help to soften that stool and help it to move better through that large intestine to give you a softer, easier poop.
Love it. No, it's great. And just so everybody knows, the large intestine is the colon. Yes. And so the colon, it travels up and across and then down onto the left side. And then it goes out of your rectum and then out of your anus. And so I think it's good to understand like the anatomy there, because if you think about like what's above that is your diaphragm. So that's your breathing muscle that like on the video here is right here. And so, you know, we kind of need this downward motion to help if we're breathing through our diaphragm to help that digestion move along, you know? So that's another thing to think about too. But yes, the hydration is huge. And, you know, what I tell my clients is like, you know, working your way up to about half of your body weight in ounces, as a base, because, you know, if you're exercising, you're going to drink more. But, you know, if you talk to people, a lot of people, we've been told all of our lives, drink more water, drink more water, drink more water. And it's like, well, I mean, you can drink a ton, like you can over drink water too.
Yeah, so you can.
To have some guidelines with that. And that's not to scare anybody to not drink water. I'm just saying like having a guideline of, hey, you know, this is a good baseline. Would you say that's something that you tell, and then what do you usually tell clients?
Absolutely. So half your body weight in ounces is a good recommendation. But then I also want to make sure that people are not drinking large quantities of water at just certain parts of the day, because then what's happening is we're intaking this large amount of water. Our body doesn't have the proper amount of time to absorb it, and it's just going right through our system. And so I really encourage my patients to try to sip water throughout the day. And so that way our body's really able to absorb that fluid more appropriately as well. So another little caveat.
I think that's a great point, because people, I think they really do chuck water. And here's the thing. If you only drink 2 8-ounce glasses a day of water and you weigh 200 pounds, I'm not going to tell you to increase to 100 ounces overnight. Like that's a lot on your body too. Like to go from, 16 ounces of water a day to 100, like let's just maybe double that. So if you're at 2 8-ounce glasses, like let's try 4 8-ounce glasses, right? So then you're at, a third of where you're supposed to be. And then you can kind of gradually increase from there. But yeah, I mean, have you ever drank a ton of water before your belly gets so full? Like, it's a pressure issue too. Like there's only so much your intestines can hold too,
Yep.
But yeah, no, I think that's a great point is sip on water, drink it, just kind of make sure you're hydrated. And, I think one of the bigger things that I find with people is sometimes they're like, I just don't like the taste of water. And, there's alternative fluids that you can drink. Fluid. It's just also kind of, fluid in general. But yeah, no, I think those are great points. What was, okay. So then with one of the things that you were talking about is kind of upper abdominal dysfunction with constipation. So we talked a bit about the anatomy and how, so people can kind of picture what we're talking about, but what have you been seeing like with upper abdominal dysfunction?
Yeah. So really, I tie a lot of this back to, and you kind of touched on it with pressure. So pressure management. So ultimately, when we start eating, so that goes in our mouth, and then we want to get our food and our stool out of our anus at the very bottom, we're kind of just one big pressure unit. And so ultimately, if we have that urge to go to the bathroom and poop, we want to make sure that we're sitting on the toilet and that we can push down and we can direct that pressure directly towards our anus in order to let that stool come out without straining. So how I talk to people is kind of like that's a garden hose, right? And so the end of the hose where the water comes out is our anus and where poop comes out. And the start of the spigot is more up at our mouth and our throat. And so if we're sitting down, when we gently bear down, we should be able to direct the pressure, like the water, we're turning the water on, water comes out the other end, and that allows us to successfully poop. So imagine if now you have holes in that garden hose. Are you going to get as much pressure coming out the end as you need? No, you're not. And it's the same. So if we have any weakness in our abdominal muscles, or if we're someone that has a healing diastasis, that is an area where pressure can escape our abdomen, and it's not going to make its way all the way to the rectum and the anus to help us to have a successful bowel movement. And we're going to feel like we need to push and strain a lot harder in order to generate the proper amount of force to get that poop out. Does that kind of make sense?
No, it makes total sense. I mean, I feel like my clients, when we break down constipation this way, sometimes their minds are blown. Like, oh, I had no idea, because a lot of us are really disconnected with our bodies because there's not a lot of education on it, and how our bodies function. But yeah, exactly that. It's like, one of the things that we've learned kind of in the pelvic floor world is just thinking about, our core muscles as a can, and the top part of that can is your diaphragm. The bottom is your pelvic floor. The front is your deeper abdominal muscles, and the backside is the deeper back muscles. And so, if you think about it, if you're, you want the pressure to go down towards the bottom of the soda can, but what sometimes can happen is if you have the diastasis or you're not activating your diaphragm, which pushes things down, the pressure goes out towards the side of the soda can versus down. And you can see that redirects the pressure. It really kind of comes down to physics, right? Like kind of what you're saying with like the hose. And okay, the more we can kind of push down from the diaphragm, that top part of the soda can down, more it will put pressure down on the pelvic floor to help the bowel movement or the poop come out. Otherwise, if we're straining or holding our breath, holding your breath while doing it's going to push that pressure out versus like a slow exhale will push it down. I mean, it's very similar to like prepping people for birth,
Exactly.
Yeah. And so, you're birthing a little poop every day,
That's honestly how when I'm teaching pushing too, I tell people practice this while you're pooping, because it's the same mechanics. Hopefully your poop is not the size of an infant, but
yeah, that would
but still a good way to think about it.
Yeah, for sure. Definitely tearing the anus there with an infant coming out of the rectum. But yeah, so I think that's a really great way to look at it, to think about it. And, the other things you said was just like the pelvic positioning too. So if you like think about, we've seen the squatty potty, we've seen the stuff, and it's like culturally in the United States, we don't squat when we poop. And, if you think about it, it's not as natural to sit the way that we sit. So sitting with your knees higher than your hips is really going to help that kind of go down and out.
Yep. It helps with an angle.
Yeah. It helps with the ankle. Yeah. I mean, I just like, you round out your back when you do it. It's just funny. I was watching my dog. It sounds creepy, but my dog was pooping the other day. And it's just like, they go into this weird, like rounded back movement.
Yep.
That's just how they do it. And, if you think about it, it's just gravity helps a little bit more that way. And so bringing your knees a little bit higher than your hips. I'll also have people kind of rock their pelvis back and forth because, the way I tell them to is it kind of helps that colon and small intestine move a bit more. Yep. Rocking it back and forth and side to side. I like to describe it as like, what was that game that used to play in arcades that was like, it was like a plastic maze and there was like a little ball in it and then you'd have to like move it for the ball.
Oh. What's that called?
You know what I'm talking about?
I do know what you're talking about. And you have to so you're trying not to get the ball like in all the holes and like trying to get it to the end. That one?
Yeah.
Or something different?
Yeah. No, that's it. I just don't remember the name of it.
No, yeah, I don't either.
You probably, it's just like this board that you kind of tilt side to side and there's a maze and the ball goes through it and you're trying not to let it fall in the hole. I like to describe that as like your poop going through your digestive system.
Yes.
You might need to rock around a little bit, arch that back, come back and forth. Like, and that goes too with exercise, getting that movement as well can make a big difference in helping, start getting the intestines moving and then helping you that way. Why do you think exercise helps with pooping?
So just what you're saying, it just helps everything kind of move through your intestines. So movement's really good. And this is part of the reason too. I know we're talking about a little bit later about travel, or if you're very sedentary, you're just sitting a lot, you're not getting that good natural motion through your intestines. And you touched on it a little bit too with breathing. So when we're engaging that diaphragm and we're getting that downward movement, that's giving us, that's affecting all of our abdominal organs really. And so that helps to just kind of push everything through each stage more appropriately too.
Yeah. Well, also too, it's like a lot of times, I'll have people just kind of put your hand on your belly and hand on your chest and just take a big inhale. And what you'll find is that most people are breathing through the upper hand to the chest, right? And I don't know why we've developed these patterns of breathing this way. That's our chest muscles are actually our secondary breathing muscle, and our primary is our diaphragm, which is like an upside down ball at the base or closer to the base of your ribs. And so that kind of just pushes everything down when you're activating it. And on top of it, it activates the parasympathetic nervous system, which is the rest and digest system. So, like we said before, there's fight or flight response and there's rest and digest. And so if you're chronically like on the go, your gut doesn't have time to kind of get blood flow to the area and help with digestion, versus if you're diaphragmatically breathing, you're getting that downward, you're getting mechanically that downward pressure, but then also it's activating the calming of your nervous system so that you can poop as well.
Yeah, absolutely.
I mean, it's really pooping is like plumbing. It is plumbing.
It is plumbing. Right? It's our internal plumbing. Yeah.
Yeah.
We're just glorified plumbers, Mary.
We are glorified plumbers. I'm going to tell people that's what I do for a living. What do you do? What do you mean? What do I do? I'm a poop plumber. I guess I could say that. I'm a poop plumber. Yeah. I should put that on my business cards. Drop them off at professional offices.
There you go.
That would be home. What was there another one that you had said?
Yeah. So we talked about hormonal issues as well that can cause constipation.
What hormonal issues usually that you find?
So the other time that we will see hormonally related constipation is in the postmenopausal time frame. And so both postpartum, breastfeeding, and postmenopausal, our bodies are in a lower estrogen state. And so that changes the motility of our intestines, or the time it takes for stool to move through our colon or our large intestine. And so that's very much happening during that postpartum period, potentially too.
Yeah. Yeah. I think a lot of people actually don't necessarily realize that, that postpartum period, especially if you're breastfeeding, right, that change in estrogen and make a big difference in a lot of different ways. And I think this will be another podcast to talk about, but that goes with your muscles too. If you don't have as much estrogen, it's going to be harder to get that muscle tone. The more pelvic floor leaking can occur as well. And it's not like, oh, you're SOL. There's different things you can do, to help with your hormones. But yeah, I think that's definitely good for people to know. Hey, if you've tried, I always like
you've tried everything.
Yeah. I always just say like, hey, let's sit down. Let's go through all of these different things. And if you feel like you're still constipated after everything that we just talked about, then maybe that's something you can talk to your doctor about. Cause I'm never the first person that's going to be like, oh, go get XYZ unless they actually really need it. But
yeah,
most of the time people just aren't chewing. They're, it's been an ongoing thing or not enough water. Most people, they're like, and the other thing that's interesting too is like the mechanics of pooping. Like when you're pushing, you should be pushing down. I've seen people pull up when I say, do the motion when I'm doing an external assessment of their anus and vulva, I see them pull up and I'm like, okay, well, if you're contracting your pelvic floor, the poop can't come out. Like you're
just holding it in. Yep.
Yeah. You're closing that hole. I've actually seen this with kids too. Like I don't treat peds currently, but I've talked to a friend whose son was having some constipation issues and, it turned out he was pulling up because it hurt when it came out.
Yep.
And they were like, whoa, I had no idea. That's something we didn't talk to anybody. Nobody mentioned that. I'm like, oh, some of this is just going back to the basics. And I think it's become so overcomplicated when it's like, okay, well, let's talk. Like, how are you chewing? Are you sitting down? Are you drinking water? Are you moving? Just basic kind of functions. And like you said, if it doesn't work, then maybe some hormones might be helpful. But
that's definitely not the first go-to for especially for this population, but definitely can be playing a little bit of a role. And I like what you said too.
Sorry, you go ahead.
No, you go ahead. I was going to change the subject. So
what I was just going to say is I like to give people all of the information. It's not my place to judge. It's not my place to tell them what to do. It's my place to be like, these are your options. This is what I would suggest you do these things. But if you want to go this route, I support you. I want you to have all the facts and then you decide. I feel like there's too much judgment in healthcare by practitioners where there's like a lot of gaslighting and a lot of telling people what to do. Versus like, hey, let's have a conversation. What works for you in this phase of your life right now?
Yeah.
Because I don't have time. I don't have time to be judged myself as a practitioner. Like I don't like being judged when I go to the doctor's office. I sure as hell don't want my PT doing that for me.
I think our job really is to help people just have all the information and make the best decision for them at that point in their life too.
Exactly.
And be comfortable with that.
Yeah. I mean, that is the place to be. And I remember earlier in my career, I was like 25. I was like, people aren't listening, like whatever. And I'm like, it's not about me.
Nope.
It's not about me. And I think I really realized that after getting injured and needing to go to rehab myself and just going through a lot of personal stuff, just going through my cancer treatment in 2019. And it's like, man, it's not about the provider. Or the practitioner. It's about the person in front of you. And so if they don't listen, it's nothing to do with your ego.
Yeah.
So sit down, and
get out of the way.
Get out of the way. And you show up for that person just because I've been on the other side way too often. And, that's just part of the reason I wanted to do this podcast and, working on the book and all this stuff. Cause it's like, People need unbiased access to this type of education.
Yeah, absolutely.
You know? One of the other questions that I had for you, we already answered a lot already. It was like, what could somebody do right now? You know, we talked a lot about water intake, exercise, changing the position of how you're sitting on the toilet, and sitting down and chewing, you know, and enjoying your meal, and really thinking about the taste of the food that you're eating, like the sounds that you're hearing, like pulling yourself into that present moment is really going to calm your nervous system, which I know it's really hard to do at times, especially if there's a lot of stimulation. There's kids, there's work, there's a lot of things. But even just thinking about it for a second and pulling yourself into just chewing a little bit more and being more aware of it. And whether you're ready to do it or not, you might not be ready to do it or not yet. You just want to get through the day. That's fine too. I want you to have the information. So how can, you know, I get this a lot when people come in for constipation. They're like, how can physical therapy help me for constipation? I'm like, that's weird. What can you do?
Yeah. So
a little bit about, how you would approach that question.
Yeah, absolutely. So a lot of it is some of the education that we were just talking about, and providing that to patients and making sure that they have all the information that they need to make really good decisions for themselves. But what we can also do is make sure that we're going over what I call a good bowel routine as well. So this kind of goes alongside the helpful tips too, but hearing things that stimulate the bowel and give us the sensation that we need to have a bowel movement. So generally we will feel the urge to poop most first thing in the morning when we wake up and after we eat, and when we drink warm liquids. And so if we pair all three of those together, that definitely can help someone have a successful bowel movement. So talking about that, we will then, from a more practical hands-on standpoint, we're definitely going to assess your abdomen. Look at, are you able to engage your diaphragm and breathe that way? Like you were talking about, most people breathe with their chest and don't even know how to engage their diaphragm. Or is there something maybe that's restricting their diaphragm from moving, and they've heard the advice over and over again, well, just take some deep breaths, it'll help calm you down, or do this or do that. But if their diaphragm physically can't even move because it's stuck, we want to help to unstick that and retrain that muscle to work appropriately. So you can take a good deep breath and get that diaphragm moving. Really looking at your abdominal muscles and that deep core and making sure we know how to properly engage those muscles and to do that appropriately. Because we don't want to go to the other end too and keep everything tight all the time and really start, gripping those ab muscles all the time. So we want to find that good balance of muscle activation and relaxation. We want to look at potentially how, if you are actually bearing down correctly. So like you were saying earlier, are you really contracting your pelvic floor muscles instead of letting them rest, elongate down and letting that poop come out? If you're holding them nice and tight, some people don't even know what's going on, and have I found sometimes really poor awareness of their pelvic floor, and they don't know if they're contracting. They don't know how to let those muscles relax. And so we need to really help them to take a step back and build that awareness first and foremost with what's going on in their body, and then building that control over, okay, so now I do feel that my pelvic floor is tightening instead of relaxing or elongating. How now can I change that? What message does my brain need to send in order to get the desired movement that I need? And just really helping patients through that process. And that's going to be a little bit individual too. So not every cue works the same for every patient. And so some people need more hands-on, some people need less hands-on. And so working through those different strategies with that, and then really talking about managing that pressure system as well, like we were talking about earlier. Again, just making sure that we're having those good pushing mechanics, not overstraining, which can cause other issues with our pelvic floor and our system as well. If we're consistently, tightening our throat and really increasing our abdominal and pelvic pressure, trying to poop, can lead to another host of issues that we don't want people to have to deal with if we can prevent that. So that's a little bit of what I tell people in a nutshell.
Yeah, I like how you talked about the throat stuff because, with swallowing and with chewing, there's a correlation between jaw tension and pelvic floor dysfunction.
Yes.
What does pelvic floor dysfunction even mean? I mean, really, it's like if you clench your jaw, you're likely clenching your anus and your vagina, your vaginal opening. And so with that, you're telling your body nothing in, nothing out, like you're just, and so why would it want to eat and why would it want to poop? And so sometimes even just, having people just stick out their tongue, massage their jaw. Because if you feel like your jaw is tight, you're probably squeezing your anus. Let's be honest.
No, that's what I tell people all the time. I mean, that's my natural tendency too. I'll catch myself now that I have that awareness. I'll be at a stoplight and all of a sudden my jaw is clenched and I tune into my pelvic floor. I'm like, okay, we're safe. There's nothing going on right now. So I now can take a deep breath, let my jaw, let my pelvic floor relax and go about my merry way. So some of it is helping people to get to that point, right? And not to say that you're not going to still catch yourself, but you can catch yourself.
Journey.
And then you can change it. And so really that's why I say bringing awareness to what your body is feeling is so important. Really, I find that a step one. If someone doesn't have that awareness yet, we can't change the way your body is functioning or help you to change the way your body's functioning.
Yeah. Check in with your body. Sometimes a lot of people have the Apple Watches now or some type of tracker. It's like whenever it tells you to breathe or move or something, use that as a cue to check in with your body. Are my shoulders hiked up? Is my jaw tense? Am I squeezing my butthole? I mean, it's just the reality of what happens when we go into this fight or flight response, which we live in a culture, we're in the United States. And so it's like we live in an urgency culture. Where the more you get done, the more, happy we think we'll be, when the reality is we need to slow down. Our bodies aren't meant for this hustle and bustle, nonstop, go, 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 go. We're meant to enjoy life and slow down. And like I said, I know there's different factors that can limit that: money, family, time, all these different things. I'm not saying drop everything and go to the beach for 6 months. I'm just saying, check in with that stoplight. Are you clenching your jaw? Are you squeezing your butt? Like, what's going on? And I think people don't correlate. And heck, I didn't either until I started doing my pelvic floor training. The jaw, I mean, it's all the same part. Beginning of digestion is the mouth and end of digestion is the anus and the urethra, right? So we're peeing as well. And so I'm glad you brought that up because I think that can make a big difference too. And so one of the other questions that I hear a lot about, and this doesn't necessarily apply to Nancy, but I wanted to bring it in anyway, was people complain about being constipated when they're traveling all the time. I mean, it's a thing, right? And so
that's me.
Yeah, you're constipated when you travel. Should put that on your business card too. I poop when I travel.
Or recovering non-travel or non-pooper. Something like that. I don't know.
Constipated, yeah.
We'll have to think of a catchier name for that. So there's really several things that go into this. So our bowels love routine. Love routine. So, generally most people poop at the same time every day. Bowels love it when we go to bed and wake up at the same time every day. That's what they thrive on. So when we're traveling, oftentimes our routine is completely changed. We're going to bed later, or maybe waking up later, maybe waking up earlier. Depends on what kind of trip you're on. Or probably not drinking the same amount of liquids or enough of the same amount of liquids. So maybe where we normally don't drink alcohol and now we are, that's going to change our bowel habits. We're probably potentially not drinking enough water or spacing it out well throughout the day. Our food choices might drastically be different. That can definitely impact our digestion, stress level. And so this kind of goes back again to how is the nervous system involved? So when we increase our stress and anxiety, that definitely activates our sympathetic nervous system, which increases our pelvic floor tension, puts us in that fight or flight mode, which we already know is going to impact our ability to poop. It also will decrease. I found this really, really interesting between, I feel like gut-brain communication is kind of a big buzzword and it's being talked about more than ever now, which is fantastic. But what they found was when we have increased stress, changes our serotonin levels, which then slows down the speed at which things move through our colon and our intestines, which is going to equal more constipation, as we kind of already talked about. It's going to decrease the amount of secretions. So that's going to decrease the amount of fluid that's actually going into our gut and our intestines. So again, our stools are going to become harder and more dehydrated. So that's going to be constipation. And then it also changes the sensation that we have in our intestines, and potentially, that signaling we might not feel as much that we have to poop because that sensation is a little bit decreased. And so that's definitely the stress response that happens, and very much can happen when we travel. So we might, different toilets, all those things.
Well, yeah. And I think a lot of people just don't like using public toilets. I think, that's a big thing too. But yeah, no, I think that's spot on because, one of the biggest things that I tell people when I get stressed traveling, I'm very sensitive to sounds. And so what I tell people is like going through all of your senses, right? Like your vision, like is vision an issue? Like, do you feel like if you have all 5 sensations overstimulated, your brain is just in fight or flight mode, right? So if you're eating something spicy, so taste, you're smelling something strong, smell, you're hearing something loud, you're seeing something bright, and then you have touch, like something is like hurting you. It's like, oh my God, that when you have history of anxiety or history of travel, like stress with traveling and things like that, check into all of those senses. And one of the things that I do myself, and I find a lot of people are more sensitive to sound, is I put on these are noise canceling headphones. And I don't even, obviously, if I'm not traveling with other people and stuff, or like, I don't have, personally have kids, but it's like, so it might be hard to do if you have kids, but if you're not, and that's something you can do, put on some headphones, and it calms my nervous system so much more. Cause you go into the airports, you've got the fluorescent lights, you've got the people running into you, you've got the sounds, you've got the smells, you've got the, all your senses are being activated. And, it's also something to think about with that, and then we've got a lot of stress with airplanes, with people fighting on the airplanes. It's like, oh my God.
Yep, exactly. And that's even before you get to your destination. And so
that's all before you get to your destination. But what I'll do is as of now, TSA lets you go through with ice. So I'll get a big bottle of water and then just put ice in it. And then I just, go to the refill stations and make sure I stay hydrated because, what the trade-off with that is that you're going to be peeing on the plane, so you can kind of gauge where you're at with that. But thinking about, you can even rock your pelvis up and down when you're sitting on the plane. You can twist your upper body and stretch your mid back. You can do some diaphragmatic breathing. You can drink that water, try to add like a veggie or something to one of the meals that you're eating. I would say, like you said, focusing on calming your nervous system as much as you can. But no, I think that that's exactly why a lot of people have those issues.
Yeah, absolutely.
So I just want to summarize for Nancy what we just talked about and the listeners, just because we talked about a lot. And so, some of the bigger reasons where we can get constipated are not enough water. So we want to work our way up to about 50% of our body weight in ounces. Stress, because when we have an increased activation of our sympathetic nervous response, the blood diverts away from our gut. So it's harder for us to digest and goes to our arms or legs because it thinks we're being chased by a bear. Body does. And so it's going to go into that protective mode. A decrease in estrogen can potentially cause that. Poor breathing mechanics, not having as much of if you have potentially like a hernia or a diastasis recti, that could potentially do it. And some common ways that people can work on it are diaphragmatic breathing, drinking the water, learning how to breathe, going back to diaphragmatic breathing, learning how to breathe through your lower rib belly. And then, if those aren't working, pelvic floor physical therapy can really help with the ways that you discussed. And then if you're traveling, trying to stay hydrated, try to calm your nervous system and try to get in some quick fiber when you can with, not as much like you said, the supplements, more so the real fiber that's going to help promote the digestion. So, well, thank you so much for coming on. How can people reach you if they would like to connect with you? What is your Instagram handle?
Yes, that's a very good question. We should be at Weeks Wellness as our Instagram.
It is.
Yep, it is. Okay.
Wellness. Yeah.
So they definitely can follow us, message us on Instagram, and we can definitely help to answer any questions or guide you to appropriate resources or clinicians potentially near you. I know sometimes people have difficulty finding, a pelvic floor PT. So I always like to be able to help if I can to get people where they need to go. So thank you so much, Dr. Mary, for having me. Talk about poop. I love it. Oh my gosh. Not everyone lets me talk about poop for this long.
Oh my gosh. So. I hope this is a great episode for everybody. But you guys can follow me at Dr. Mary PT. So it's Dr. Mary PT. And if you subscribe to our newsletter, we'll up-to-date you with the upcoming episodes. So that way you guys can know what's coming up next. We've got a lot of fun questions about sex, wellness, and all the things. I do have a freebie on 3 ways to help you stop leaking with exercise. That will be in the show notes if you'd like to sign up for that. And we'll see you next episode.